personal?
Abir, what's going on? Julio, your exam's October 8th, isn't it? Julio, your exam's October 8th. Anila, what's happening? Shiva, what's happening? Chaitanya, best way to revise OBGYN? The best way to revise OBGYN would be to do the repro/OBGYN PDF that we have. And we also have a repro OBGYN playlist here on the YouTube. Chaitanya. Mohammed, how you doing? Werner, what's happening? Dusty, what's going on? Shiva, you got some of the Anki to work. Podosen, good to see you back. Podosen. Jim Solak, good to see you back as well. What does doing offline NBMEs mean? How to do them offline? The offline NBMEs are 20 through 25 for step 1 and 6 through 8 for 2CK. So you'll do those in addition to the online forms. Jim Solak. Guys, don't give the live stream a like. Don't give it a like. Hamza. What does an abnormal INR value indicate for USMLE? It indicates that your PT is elevated. That's what it means. Rashed, good to see you. Muhammad Ali, you got a 74 on NBME 26. Can I take the exam in 2 weeks? Absolutely. That's good scores. So 68 plus on 3+ NBMEs is what we want to see. And 65 plus is pass. So 74, obviously, you're clearing by a wide margin, which is good. But you have to take the other NBMEs and you have to get consistent marks on those NBMEs. Abdul Ram Syed. How can you study ethics and biostats for step 1, just starting them late? Well, I've talked about how you don't want to start biostats late. You guys want to do biostats longitudinally throughout your prep. Don't save it for last because you need a lot of REM cycles to sleep on it and to learn biostats. Ethics and communication, you can do our communication ethics PDF on the free stuff tab. But I wouldn't obsess over ethics though. We have the PDF, but a lot of what you see on the real exam is going to be intuitive, and it's not stuff you can study for. It's just EQ. What seems most reasonable to say to a patient in this situation? What seems most empathetic? A lot of that stuff is just like intuitive. But biostats do not save for late. Julio, yes, your exam's October 8th, and you got a 71.5 and NBME 25 yesterday. 5 days ago, you got 61 and NBME 24. I like that you obviously got a 71.5, but I do not like that inconsistency with NBME 24 at the same time. Okay, let's just have consistent grades above 70. How's that sound? But the 61's a fail, so we can't ignore that. Taha, good to see you back. Commander Artemis. Let me see. You think you can make a high yield, must know, guaranteed path playlist? Would like to know. I saw your DM on that, or I think you DM'd me about that. I don't think it was a YouTube comment. I think you DM'd me about that because our path playlist on the YouTube has a lot of questions, like 800 questions or something, and you want like an even higher yield playlist. Well, guess what? Most of the exams path. I mean, it's a QBank. It's literally a QBank, the YouTube. So we've got like, I don't even know how many, 1460, 1470 questions. So it's a QBank. The same way if you're going through actual like Mehlman QBank and you do all the path questions, it's not going to be like 20 questions, right? It would be like 1,000 questions or something. Sarath Gola, how can I retain info without your Anki? Well, you can just read the PDFs the best you can and then just don't forget what you read. How does that sound? I've talked about this a lot as well, that most people don't remember what they read. So if you're reading the PDFs and you can retain them, great. But if you can't retain them, that's the benefit of the Anki, is the spaced repetition. Dr. Artie Produku, good to see you. You got a 66 and then maybe he's 27 and 28. What would you suggest for me to increase my score? I'd want to know when your exam is. That's the first important point. So when you write your next comment, also write your scores again and stuff. Don't think I'm going to memorize your stuff right now. Salah Hayden Mustafa, tips for patient safety for 2CK. Well, patient safety for general, in general for step 1 also is wash your hands, okay? Like, I mean, what do you need to know for patient safety? That's take out catheters when they're not being used. Like a lot of that stuff is like, honestly, just IQ. Like there'll be like a catheter was in giving antibiotics. The antibiotics were stopped like 2 weeks ago and the catheter is still in. What do we do? And the answer is like, take out the catheter. Do you guys know why having a catheter in is a problem? If you're not using it, do you know why? It's infection risk. So it's really high yield for USMLE. Take out catheters like as soon as possible. You never want a catheter in someone's arm if you're not using it or if it's not vital. Urinary or in their or elsewhere, doesn't matter. And for 2CK, they'll throw that sort of surreptitiously in the vignettes. They'll give you like a 10-line paragraph with a vague mention of a catheter. Kavik Shah, importance of biostats, obviously very important. If you want a serious performance on the 2CK, then if you want to pass step 1, you got to know basic biostats, yes. Why don't you, Werner, why don't you make a section for arrows in your QBank? We actually, we had that as an idea and I scrapped it. I decided I didn't want that as a category, arrows. But we have tons of arrows. So high yield arrows PDF, guys, when I went through making questions, I turned all of those into real QBank questions as well. Okay, so like long QBank questions, all that arrow stuff. But I didn't want to make it a thing, quote unquote. I mean, because arrows is physiology. A lot of that's just physio. Okay, so physiology. That's your arrows. SD. Saad Nasser. What's up with the long sub questions in recent step 1 exams? You gave yours yesterday. I made a reel on this like 4 days ago. And all the reels come from the live stream, so I talked about it clearly. But I said, don't worry about SOAP questions. Like, seriously, guys, don't turn this into another hysteria. Okay, the hysteria regarding SOAP questions, that the exam's not similar to NBMEs, which is nonsense. Okay, risk factors, like these things that people get hysterical over, and it's nonsense. Okay, so all it takes is one low IQ post on Reddit about like, oh my God, guys, there were SOAP questions on The Real Deal, oh my God. And then you've got like other low IQ people who don't know basic, like what DKA is, but then they're like researching about like SOAP questions. I mean, let me ask you this, okay, you guys watching this, like if you just knew basic medical knowledge and you just looked at a patient's chart, wouldn't you be able to synthesize that information like without a problem? Yes. You don't have to be sitting at home on your bed, like looking up SOAP questions. Like it's just look at a patient's chart and you understand what's going on if you have basic medical knowledge. So just study like a normal person, and SOAP questions aren't going to be this like dramatic thing for you. Werner, do you plan to come out with self-assessments for the steps? We do, but it's not our most exigent or urgent thing. We're working on the shelf banks right now, the shelf series, the 1,000-question QBanks. We'll have those done within like 2 months probably. There's some other considerations we're making, but that's what we're going to have done within like 2 months. And then we can go on to other things. Like we might do a mobile app. We might do the self-assessments. And then in 2026, we'll do another online interface with like a library, like PDF stuff with card integration, but with the color schemes and analytics similar to QBank. So right now, like you have the Anki, which is a level up from the PDFs. The PDFs are 11 out of 10, but the Anki obviously, that helps with spaced repetition. Certain people like Anki, right? That it's about speed, but you'll have the option as well to go even another level / layer up with a library and analytics, so you know exactly like what other people are doing too. How much time do other people spend on this content that you're spending time on? That type of stuff. Dr. DBO, how do you do better on the shelf exams? Well, you're just gonna have to cover all your bases in the rotations, right? So you're gonna do the PDF that we have for each rotation. You'll do the playlist on YouTube for each rotation. You'll do the CMS forms for each rotation, in addition to QBank. Rocio, Vega. It's a lot of Rocios that follow me. I've also blocked a couple of Rocios. If I work from 8 a.m. to 1 p.m., Monday to Friday, which subjects do you think I need to prioritize for step 1? Well, regardless of your work schedule, I would say endocrine and path. I've already discussed that a lot. So do the high yield endocrine PDF, do the high yield path PDF, do the ARAS PDF. Beer, can someone study for step 1 and step 2 at the same time? Yes, but it's not a good idea. Co-study is always a problem. I don't like when people are on rotation studying for both at the same time. It's never a good situation for people. The chat moved on me. I'm just scrolling back up. Okay. Tashal, Luba, good to see you too. Sam, Jacob, good to see you again. Your exam's on Tuesday and you scored a 67 on NBME 32 yesterday. Okay. That's borderline. So if you were one of my students, if we were meeting on Zoom, okay, you're one of my students and you told me you got a 67 on 32, you know what I would tell you? I would tell you I don't sign off on you sitting the exam. I'd want to know what your other NBMEs are. Okay, so we'd have to look at your other NBMEs and you and I would have to have a discussion. Think of it this way. Think of it as like you've had your ACL repaired 5 weeks ago. That's what a 67 would be like. Like, the doctor says like, oh, just take it easy, 6 to 8 weeks, right? And then it's like, it's been 5 weeks and it's sort of like, well, it's borderline. It's like, look, like you can go into the exam and pass because a 65 is passed, but you got to know that you better not fuck up. Like you have no room to fuck up because you passed by like a couple questions, like 3 questions. So you would have to go into the exam and not have a bad day. I like people getting 68 plus. I don't want it to be a YOLO. Like you'll probably be fine, but I would tell you like you're borderline and I don't officially sign off on your 67. So we'd have to look at your other NBMEs and you could do 19 and earlier. That's what you could do. If you're already on 20 through 31 in addition to 32 and free 120, I'd have you do like 19 and earlier and we look at those scores. If you're getting 68 plus on 3 of them, you're fine. Otherwise, we'd be looking at having you take a step back, do Mehlman QBank for a month, and then come back to the NBMEs, which at that point you'd be in the 70s. Okay. Thank you for making a katakana name with my name. That's ridiculous. Mehlmanmedical, Mehlmanmedical in katakana. Would you talk about the highest yield points for H. pylori etiologies? Like, I don't get it. Does it cause ulcers or gastritis, etc.? I feel so vast in terms of etiologies. Etiology means a source, that is H. pylori itself, but H. pylori, you need to know, is the most common cause of duodenal ulcers. Okay, so after you've eliminated H. pylori as a cause, then you can look at things like gastronoma. But H. pylori does cause type B gastritis, which is of the antrum. Okay, it can cause not just ulcers there, but also malt lymphoma, gastric outlet syndrome with succussion splash. Type A gastritis is of the fundus and body, which is your antibodies against the parietal cells, pernicious anemia. Okay, but the 2 things, duodenal ulcers and type B gastritis. Obviously gastric ulcers as well, but NSAIDs can also cause gastric ulcers. NSAIDs tend not to cause duodenal ulcers as frequently, not nearly. Okay. It's not that H. pylori has a tropism for the duodenum. It's that you just have other causes in the stomach, like NSAIDs, as we said. Occasionally Cushing and curling ulcers, but those are more obscurities. Do you guys know how to treat H. pylori? CAP, CAP, clarithromycin, amoxicillin, PPI. And if that doesn't work, you can substitute out the clarithromycin, amoxicillin for other antibiotics, metronidazole, tetracycline, plus or minus bismuth. I mean, USMLE really doesn't care, to be honest. What kind of advice can you arbitrage from repeated rejections to USMLE prepping from your life? Right. There's a lot of like politically incorrect stuff that goes into that I don't really necessarily want to introduce into this live stream. Okay. That stuff was more applicable back in 2020. Let me just say that in the very beginning in 2020, when no one knew who I was, I did a lot of poaching. Like I would go out, like I always had word of mouth tutoring. I always did, but I would like try to find people and try to get clients. And that was like 2020. And now, I mean, I just delete like most of the people who message me for that stuff. It's not an ego thing. It's sort of like, I mean, it's probably similar to like a chick who's a 10 who gets like DM bombarded by like a bunch of like cuck dudes. It's probably like that. Like probably how most girls are on like dating apps is like how I am with like medical people fucking messaging me with like medical stuff. That's literally like, I think I can like empathize that way. That's probably like what it is. Tagua. Will I still get questions wrong on second round of UWorld? Why are we talking about UWorld? We have Mehlman QBank. Yavo here, Malakulov. 1 year break after step one, how to start CK. Well, if you've had a 1 year break, you've probably forgotten everything, but regardless, you would start off by doing QBank for CK. So you would do Mehlman QBank and you'd start with our PDFs. Internal medicine PDF would be a good start. And our playlist, you could do internal medicine playlist. You're gonna have to start with QBank. So you do Mehlman QBank, 2CK, easy. Mo, how can you highlight things that need to be memorized or not? Are you talking about like physically highlighting literally within the QBank, or are you saying, how do you know what to emphasize? Can you elaborate on your question? Ali Akbar. I mean, come on. Talk about Crohn versus ulcerative colitis. I tend to confuse them a lot. Yeah. I mean, I've done a lot of clips on that. Ali Akbar. Do you guys know the most important biopsy finding for UC versus Crohn? Which one is transmural? Crohn, okay, that's easy. UC is not transmural. So UC involves which layers then if it's not transmural? It's the mucosa and the submucosa, not the muscularis propria, the way Crohn does also. Okay, and then what else do you see in biopsy of Crohn? Do you know? It's non-caseating granulomas. So non-caseating granulomas with Crohn and also sarcoidosis, those are probably the two highest yield conditions in USMLE. Berylliosis is the third you could know. I've seen one question, so it's not even like really high yield, is it? But I've seen a question where you can eliminate berylliosis based on that as well. Okay, and then caseating granulomas, your TB, fungal infections, and even Barnell-Henselae. Okay. What do you see on contrast enema with Crohn versus UC? Do you guys know? So UC, you see the lead pipe appearance, right? The loss of the haustra. And then Crohn, you see the string sign. So areas, segmental inflammation. Okay. Cobblestoning on colonoscopy versus pseudopolyps with ulcerative colitis, crypt abscesses, ulcerative colitis, creeping fat with Crohn. Do you know like what part of the bowel is affected with Crohn versus UC, guys? So UC is rectum ascending, Crohn is mouth to anus. So Crohn, you can get, let's say a patient has a mouth ulcer, that's it. But if we had to choose one location for Crohn, do you know where in the bowel is affected? It's the terminal ileum, okay, for Crohn. And then you got to know extraintestinal manifestations. So what's the highest yield intestinal manifestation, extraintestinal manifestation of UC? It's primary sclerosis and cholangitis, right? Okay, you get beating of the bile ducts, sometimes p-ANCA positivity. Crohn, sometimes you can be anti-Saccharomyces cerevisiae antibody positivity. Okay, but and then things like erythema nodosum and anterior uveitis, they're non-specific, but they tend to show up more with Crohn than UC. And then pyoderma gangrenosum and obscurity, but you can get that with UC. How was that seminar? Did that fulfill you, Ali Akbar? Seha Jean Sayal. I finished about 90% of my Mehlman QBank, and I've been averaging 75 to 80 on my NBME forms. You take CBSE Friday. Do you think I'll be fine, or is there anything else I should do? Do I think you'll be fine with 75 to 80 on your NBMEs? I think you'll be fine. Mac. Mike, in the early days of tutoring, was it annoying when med students asked very specific details or tangents, and how did you tackle not knowing something 100%? That's never really been a problem for me because I've always known stuff well. Like, at the risk of sounding like supercilious, I mean, that's never been an issue for me. I would say it's more about keeping people in check even now. Because like sometimes I'll have someone come to us, I'm like, you have any questions? And they're like, can you tell me about this like obscure enzyme? And I know the patient, I know the student's like struggling. And I'm like, do you know what an ASD sounds like? Guys, do you know what an ASD sounds like? Fixed splitting of S2. Do you know what a VSD sounds like? Holosystolic murmur at the lower left sternal border. Do you know what tricuspid regurg sounds like? Holosystolic murmur that increases inspiration. Do you know what mitral stenosis sounds like? Versus mitral valve prolapse. Mitral stenosis, opening snap. Okay, mid-delayed decrescendo diastolic murmur. Rumbling diastolic murmur. Mitral valve prolapse, mid-stonic click. So if you don't know what those murmurs sound like, and you're coming to a session asking me about ornithine transcarbamylase deficiency, X-linked recessive with urea cycle, and acetylglutamate as a cofactor for carbamoyl phosphate synthetase 1, if that's what you're going to come to a session asking, but you don't know what mitral regurg sounds like, then we have a problem. You're not allowed to ask questions. Like, you know, that's the thing. You're not allowed to ask certain questions unless your knowledge base is good enough. Masa, you got the QBank, you got Mehlman QBank for step 2. And you only got 3 out of 10 correct on a block, 7 incorrect. Is that normal? By the way, I've done all the PDFs, YouTube MCQs for step 1. I wouldn't worry about your percentages in QBank. Just whether you're getting a 3 out of 10 or whether you're getting 8 out of 10, just continue through the QBank. Olumad, good to see you back. I just want to say thanks for your advice on working out in the gym. Helps my discipline. I even get more questions correct in QBanks. Was skeptical at first, but thanks a lot. Yeah, it's pretty standard. I've actually been going to the gym 2 times a day right now. Like I lift in the afternoon and then I do cardio at night. So it's 1:36 a.m., but like maybe around 4:30 a.m., I'm going to go do cardio. Is this a USMLE sesh, or were you talking about my gym routine? Mike, have you thought about acting more beta in your videos to gather data on engagement? That wouldn't be possible for me. Like I wouldn't be able to. That would be like asking like Trump or Tate to act beta. Like I can't really like act, I'm just not beta. That's why I'm a target, is because like I'm a straight alpha male, so I get targeted. That's pretty normal in today's society. Jessica Muna, do you think I should worry too much if I'm not great with biostats? Probably, because you need to know basic things like sensitivity, specificity, PPV, NPV, NNT, NNH. Like you need to know those things. You should know what a p-value means. Jez, you get a drop from 77% to 72% on the NBMEs. What should you do? You didn't drop. It's coincidental, because if you sat those two NBMEs in reverse, you would have thought you went up by 5%. So it's coincidental. You didn't drop. I've talked about that. Julio Boye, I've said just do the other NBMEs. Julio Boye. Mo Awad, are your QBank sold separate, or is it purchase accessible to all three steps? They're separate. They're not, it's not accessible to all three steps. If you buy like a red Ferrari, do you get automatic access to like a white Ferrari after like a year of use? No, that's not how it works. It's not how it works. Guanki Gaming got a 237 in step 2 CK. Could I match in diagnostic radiology? I don't think so. You got to be reasonable. So you can apply to family medicine, internal medicine, surgery, peds, obs-gyn, psych, not radiology, unless you want to just waste all of your applications. Why would you want to do radiology? Do you actually have an interest in sitting in a dark room looking at like images all day? Is that what your interest is? Or is it about the cash? It's the cash. You don't have interest in radiology. You have zero interest in radiology. It's the cash. Because let's be real, if family medicine paid as much as radiology and radiology paid as much as family medicine, you wouldn't have an interest in radiology. You'd be talking about family medicine. So let's not pretend. Let's not pretend that you have an interest in radiology. It's just the cash. That's it. That's all it is. The only reason you're interested. No other reason. Baran Najir. As a non-USIMG Gen Surge, if I get pubs in American journals and get good LORs, yeah, I mean, sure, that would help your match chance. That would help. Ali Kayan, Rashad Ramzan. Yes, above 75% on NBMEs 21 to 25 in your exams in 2 weeks. You're planning on doing free 120 the rest of the NBMEs. You've done my Anki top to bottom, keeping up the review. Any other tips you have? Just finished 26 through 32 and free 120 as you're talking about. Yes, that's it. High yield arrows, make sure you go through that. But your percentages are good. You're not even borderline. You're fine. No, you can't do another QBank. When to schedule NBME 9, question mark, going through your PDFs right now. I said to write your comments. If you write follow-up questions, guys, write the original information also the best that you can. I'm not like memorizing your individual circumstance. That's funny. Mike, how can I overcome insecurities about my appearance? Would that ever go away? That's funny because I get attacked on my appearance all the time. I mean, maybe, but I think a lot of that stuff doesn't go away. Okay. I had a very negative upbringing with that stuff. I think a lot of us do. But like I had a very negative upbringing with that. And that's what led to me as an adult having complexes. It was mostly negative talk from my mom and a little bit of my sister, because I have a very attractive older sister. And so she got a lot of attention growing up, and that was hard for me. And then, she's like, well, you were the smart one. And I was like, yeah, but you were better looking. She's like, you were smart though. I was like, yeah, but you were good looking. But that was hard on me growing up. I probably get like 10 negative comments a day, 15 negative comments a day on my appearance. But those comments are all blocked now. So you can read them. If you make a negative comment, you can read it, but other people can't. So you can live in your own little world and think people can see your comments. And if you do happen to get through with a comment, then you just get hidden. You just get blocked forever, and then that's it. Do you recommend reviewing NBME questions that I've already done? Maybe. There's a time and place for that stuff. It depends. It depends. I mean, we'd have to look at what forms you've done, what your scores were, and whether we want to go back and review other NBMEs. Masa, Vo Judy. Mike, you're doing Mehlman QBank for step 2. Should you read the questions from the beginning, or should I just do like we take the real deal from the end? I've said that when you have long stems, that the way you answer those is to look at the answer choices first, then glance at the last couple lines, and then glance around the vignette like it's a wordless collage before starting at the beginning, maybe 7 seconds in. This applies to step 1 also. And those of you doing step 1 Mehlman QBank, those very, 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 very long questions, especially some of those pharmacology ones, those are me. I wrote those. Okay? Those are me. So the practice is being able to kind of look at the answer choices, look at the last couple lines, and not be spending 46 minutes getting pulled into a life story that's written there. It's practice. Mike, if you were to go back to when you started Mehlmanmedical, would you have done something different? I like how the chat just moved on me. Let me see. Got to scroll back up. I'm like OCD. I don't want to lose where I was in the chat. Let me see. If you were to go back to when you started Mehlmanmedical, would you have done something different? Not really. Not really. There's a lot of business stuff I can talk about, but I don't necessarily need to be explicit about it. You know what I mean? There's a lot of business stuff because I don't want to talk necessarily directly to people about that. But let's just say that I think intent is what matters. Intent, humans aren't stupid in terms of their ability to sense intent. So my intent was always to genuinely put out good free content for a long time, and it still is. Now that I'm selling stuff, people are like, well, you're a fucking asshole. But it's like, okay, you know, you can call me an asshole for having paid stuff, but 99.9% of what's out there that we put out is free. And that was my intent for, you know, since the beginning. It was just free PDFs, free videos, you know, just putting out free content. And so that's how it was from the beginning. And I think that that was a positive thing. There's other explicit business stuff, as I said, that I could discuss, but I don't think I need to necessarily go into that. Okay? Because as you grow in business, yes, there's things that you like, it's called ignorance tax. Okay? There's things you learn and you say, I could have done that differently. The same way if you talk to someone who finishes a PhD in 4 years, they'll say, well, if I knew at the beginning what I know now, I could have done the entire PhD in like 9 months. Okay, so there's that as well. Doc in making, yes, I saw one of those long physio arrow cues in QBank. LOL, yeah, we did. So the arrow questions are in there, just in longer form. SD, you took NBME 25, you got a 37% in July. You took NBME 21, you got a 55% 1 week ago. Really hard to correct the answers. You're not gonna, what are you saying right now? And then you just don't speak English. The point is your scores are too low. Okay, so you need 65 to pass, 68 plus on 3+ NBMEs SD. SD, ask a more targeted question. Okay, so RD, you have your exam in 15 days and you got a 66%, and ME's 27, 28. What would you suggest to increase your score? You're going to do the other NBMEs and you're going to do high yield arrows. But I would pretty much go through 20 through 26 again. That's what I would do. Like 1 day for all of those. Like for each of those. And don't worry about your scores on those because you already sat them. So you might get like 85%. It's like, cool, well, the score doesn't matter because you sat those already, but redo 20 through 26. Okay. And then do free 120, then do 29 through 32. That's what I would say. And if your 29 and 30 are not 68 plus, I would just postpone and save 31, 32. Cubbies 5557. You're testing December 20th, doing 30 questions in UWorld a day, reviewing my PDFs. Started dedicated first week of you start dedicated first week of November. What should I focus on for dedicated? My first observation is that you're doing UWorld. It'd probably be better for your score augmentation if you're doing Mehlman QBank. But if you're going to continue with that, it is what it is. And then for dedicated, you would be doing the NBME exams. So 20 through 25, free 120, then 26 to 32. Amna, you took your first NBME 25. You got almost 70%. Do you think I can place the exam in the next month? I appreciate your help so much. 70 is obviously good, 69.5. You're just going to sit the other NBMEs. You need consistency at 68 plus, Amna. That's all. DJ Berg, good to see you back. Which arrangement should we use the PDFs? Is there a specific one? I've said that endocrine, then path, then arrows are the pass level ones. Okay, if you do arrows first, in your week, it's going to be very, very difficult for you. So you can do endocrine, path, arrows, and then you can just do all the other ones like cardio, pulm, renal, etc. DM, if you had to choose doing cardio for the rest of your life or lifting, which would you choose? Lifting. Taha, what should be the ideal prep time for step 2 CK? 4 months. YB, doctor, in a recent short, you said endocrine, pathophys, most important, most commonly exam topic, step 1. Where do you recommend studying pathophys from? I've said pathophys is everything. So pathophys is being able to answer 5 to 6 basic questions about any disease you can possibly think of. Okay. Duchenne, CF, Marfan, NF1, NF2, just any disease you can think of, be able to answer like 5 questions about it. That's pathophys. Understand mechanisms for diseases. Von Willebrand disease, ITP, hereditary spherocytosis, hemophilias A and B. Be able to answer basic questions about that. All those conditions, that's pathophys. Mo Awad, you've gone through QBank once, you got a 50% beginning of the year on CBSC, you're retaking in October. Is it smart if I redo QBank path and endocrine? With YouTube, QBank's Anki working since exam. I don't know your situation. Can you articulate that a bit more concisely? Mo? Nicolos, good to see you back. You're doing farm right now. Can you tell which concepts are I must know? Also, I plan to grind your PDFs, then NBME exams November 8th. Good plan. If your exam is November 8th, I'd be on Mehlman QBank right now until mid-October, and then I would do the NBMEs. But for farm, I mean, it's pretty much everything. The immunosuppressants are high yield. The cardio drugs are high yield. Diabetes drugs, HIV drugs, a lot of high yield farm. The antimicrobials. Taha, just want to say thanks. You've been following my advice. Consistency is the key to success, as you said. Do it regardless of how you feel. I started with your Anki, QBank's finishing up. Dr. DBO, what % correct to score 250 plus on step 2 CK? Probably 80 plus %. Sadia, recent NBME scores 29, 30, 28, low 70s. Are they good enough to give the exam? Yes. How much should I get in 31, 32, 120 before I can sit the exam pass comfortably? 68 plus. Anything 70 plus on NBME is really, really good. Daniel Bowman, Your NBME is 69.5, 69, 67, 68, 69.5, 76, 75, 67, 76. Yeah, you're completely fine. You don't have to worry. Sadia, you're short on time, exams in 2.5 weeks. Which PDFs should I do? Arrows. Just do arrows and endocrine and path. Those are your past little ones. Jason Thomas, do you think Anki is needed to do well in med school? No, not at all. VOMC, you're stuck in 230s on NBMEs up to 11 after completing all of UWorld and CMS forms. Would simply revising every concept from the NBMEs and doing the new ones be a good way to improve? VOMC, I'd want to know when your exam is. That's a starting point for the conversation. Simrat Paul Kohan, you thought about getting your thought on what is your thought on getting a step 2 score after ERAS apps go in? Need your honesty? Absolutely not. Have your 2CK score first. Mikhail, what do you recommend studying for day 1 of step 3? Well, you just do step 3 Mehlman QBank. That's not hard. That's all you would do. That's how you'd start. You're going to do CCS cases every evening as well, 3 per evening. Sadia, your UWorld self-assessment scores are 62 to 66, but NBMEs 28 to 30 are in the 70s. Which score should I trust at the exam? The NBMEs. With assessments we're given with one, the assessments are given with 1 week gaps. The NBMEs are more important. So if those were higher than the UWorld self-assessments, that's good news. Okay. I've said the UWorld self-assessments are accurate. Not the percentage, but when they had the 3-digit predictions, they were accurate. So I wouldn't worry about the percentage in UWorld. What I'd worry about is your percentage on the NBMEs. So the fact that you got in the 70s, you're good. Asrar, Omer, 2 weeks is your exam. You're done with the NBMEs. Scores are good, 3 consecutive. 72, 70, 73 is it crucial to recap all topics, all files, like 3 days before the exam. Your scores are good. You're not going to have a problem passing Asrar, Omer. You're going to pass easily. 3 days out, I would look at biostats and I'd make sure you know arrows. And then the day before your exam, the high-yield arrows PDF. And then the day before your exam, just have it be a chill day. Don't really do too much study the day before. Nareem, you took step 1 a week ago. It was so hard, not like the NBME. Your exam 75 plus feels like, your NBMEs were 75 plus, feels like it didn't go well. It's all in your head. I've talked about this as well. That's just like hysteria, okay? Because the NBME is the real USMLE. It's the same. Questions are the same. So it's a form of, it's a escapism. It's a defense mechanism. Okay? It's like displacement. People don't realize or acting out. People don't realize they're doing it. Those are immature defense mechanisms. So it's like people don't realize but the exams are, the real steps the same as the NBMEs. Brenal, clinicals, you're year 4 of 6, you're on internal medicine, step 2 CK. How would I incorporate step 1 prep into rotations? It's not a good situation. You basically have to study for 2 CK while you're on rotations. And then there can be enough overlap with step 1 where you can just pass step 1. Think of it as a Venn diagram where there's like, if you just study step 2, you're going to basically learn most of step 1. The problem is when it comes down to like nitpicky stuff, if there's like biochemistry or embryology, stuff like that, neuroanatomy, like there are things that are annoyances for step 1. But if you just focus on 2 CK at this point, hopefully that should cover enough of step 1. Because if you focus mostly on step 1 rotations, you're just not going to get through rotations the way you need. Solman Shakali, can I do questions from the same system like GIT in the morning, then do the GIT PDF and GIT YouTube videos? Because I think I am lost when I do random questions in the morning. If it's a crisis for you, do what you want to do, Solman. I've just said in general, I prefer people do random untimed tutor in QBank as phase 1 of the day, and then phase 2 of the day is when they have subject-specific PDF and videos in the evening, or the Anki in the evening, subject-specific. But the QBank should be random mode. But if it's an emotional crisis for you, then you can by all means do subject-specific questions from QBank as well. Kea, Stuck in 230s, 240s, exam is in 10 days. Please kindly advise what to do to improve the score. UWorld self-assessment important to do now, question mark. If your exam's in 10 days, absolutely not. You would not do UWSA. You would do the NBMEs. Like, that's what you need to focus on the final 10 days. So I'd want to know which forms you sat, and you'd have to do those. You have step 2, Simrat Paul Kohan. Step 2 is booked for 25th September. You're considering moving it by 1 week. Score is projected to come out October 15th. If I delay it, then I'll get the result October 22nd. Thoughts on the ERAS? I've already said, don't apply without 2 CK score. Soha Batul. Thanks, Mohammed Ashraf. Soha Batul, if you've done only 20% of UWorld, should be good to book USMLE exam for Jan or wait. I would just do Mehlman QBank, actually, not your little UWorld that you're doing. Finesse. Mohammed Ashraf. Can you tell us a schedule for step 2 while working? How long would it take to get the 250? What to tackle from step 1, not forgetting stuff for step 2. If you're working, I mean, you'd pretty much just have to make sure you get through QBank. The key would be getting through our QBanks, because if you get through QBanks, then you're going to be objectively okay. Rocio. If you've got from 3, I think I already answered your question. No. If you have from 3 p.m. to 10 p.m. Monday to Friday, how many questions should you do minimum? Always 40, minimum 40 per day. Also, I saw percentages of the examination report that shows endocrine, renal, reproductive, pulmonary, higher, cardio, question mark. Just do 40 per day minimum. Sahad. What's going on, Sahad? Shanika Williams. Are you still here, Shanika? Kelvin Okwosa. What's your advice for IMGs working full-time in the clinical setting while prepping for step 2? Just make sure you get QBank done for step 2. Mehlman QBank. Finesse. LMAO Mike. The thing is that Tate and Trump have an audience who responds well to that rhetoric. That you're right. Med students are the total opposite. Look at academia. You know, you're 100% right. You're 100% right. You're right. If you're still here in the chat, you're right. Yeah, you're right. I don't need to get too explicit about that beyond what I've already said, but you're 1,000% right. And it's irony, isn't it? It's irony. Julio Boye. Perfect, Mike. Thanks. I think you already asked me this like last time. Could you explain the O2 shift curves, please? Left to right. Well, do you guys know what shifts the hemoglobin oxygen association curve to the right? Acidity, so protons, CO2, temperature increased, and 2,3 BPG, right? That means increased oxygen unloading. And then when we talk about fetal hemoglobin is left shifted in comparison to an adult hemoglobin. I lost where I was. Let me see. Scroll back up. Hi, Mike. I'm currently studying UWorld and I don't have a strong foundation. How should I proceed? I'm currently doing UWorld questions every day, 1 block, and reviewing along with FA and your PDFs. That's very interesting that you're doing my PDFs. I'm happy that you are. It's very interesting that you're doing UWorld and FA as though that's the way to prepare in 2025, which it's not, because you're correctly doing my PDFs, okay? But you're not getting your score up as much as you should be by doing UWorld and FA. This isn't 2016. This is 2025. So I don't know who told you to do that, but they don't know what they're talking about. Mark Walter, how many questions do you need on QBank to start improving my percentage? I've done like 200 questions. I'm still getting 50%. I wouldn't worry about your percentage of QBank. Okay. I said whether you're getting a 30 or whether you're getting 80, just continue with the questions anyway. Shanika. Mo Sadiq. Sorry to hear that, Mo Sadiq. Now I have like 3.5 months approximately, wonky. what Anki of yours to get, we have like we have a premium deck. You can do that. Most Sadiq. You're halfway through UWorld thinking of boards and beyond, maybe MedQuest videos. What are you talking about, bro? Literally, what are you talking about? Like, how misguided is that? Whom have you been listening to? This is 2025. Silver's cut. Can I immediately take step 3 after step 2? The answer is with 1 month of exercise. Yeah, you can. Maybe like a month and a half. Because you do our step 3 QBank, which is 1560 questions. And you need to do CCS cases. But if you just sat step 2, you can bypass the CMS forms and all the 2CK NBMEs for your step 3 prep. I normally have people do those for step 3 prep, but if you just sat step 2 and you already did those, you can bypass them. You don't have to do them again because of the proximity. But if your step 3 is like 2 years later in residency, after your step 2, then you would need to revisit all the CMS forms again and all the 2CK NBMEs again. Yes, for step 3. Indrashish Podar, you've completed 20 to 25 NBME, 62.5% NBME 20, the rest for 68 to 75, 75% free 120, 62% new free 120 with a 101 fever. I don't like that. Should I continue with NBMEs 25 to 32? What do you think I don't like? If you're still in this chat, what do you think I don't like about the fact that you mentioned a fever? I don't like excuses. I don't like excuses. So you got a 62, handle it, okay? It doesn't matter that you had a fever. You have to perform. Sam Jacob, I got a question on my NBME saying TNF alpha was responsible for the fever. IL-1 was not an option. Please explain. I'd have to see the question, but IL-1 is fever. TNF alpha is increased vascular permeability, low blood pressure, decreased systemic vascular resistance. If you said if it's not an option, there you go. You have to use your brain, okay? So if like the peg, if the round peg doesn't fit in the square hole, there's going to be another like option, okay? So that's exactly right. IL-1's not listed. So there was like there's always like an exception they can pull. That's what makes teaching difficult sometimes, is they always have these little exceptions. That's why in some of my clips, I say 14 out of 15 times, 7 out of 8 times. You notice I say that a lot in my YouTube questions? It's because that's how it is on the NBME. They'll be like, one question, and I'm like, this is the 1 out of 15. Yes, it's weird. Sam Jacob, you got a question on NBME? I just fucking read that. How to tackle the ad questions, step 2 CK. I literally just put out a reel on this yesterday, drug ads. Go to my Instagram, look at drug ads. There's like a reel on it. Okay, I've said that you can flag it and come back to it because you're not going to know how much time to spend on it. Do you have 30 seconds? Do you have 12 minutes? You don't know. So you can flag the whole thing, come back to it and read the little mini research article, drug ad, okay, rather than getting pulled into it too early and then you don't have enough time left in the vignette or in the block. Renal, your resources are UWorld and my Anki. Well, I mean, obviously the Anki is an intelligent choice, but UWorld's not. But you can continue with UWorld. It's not an issue. Just I recommend getting Mehlman QBank, and then you can have the juxtaposition to see that ours is better than UWorld. You don't have to stop UWorld, but you can have the juxtaposition of doing ours also, and then I think you would just self-stop UWorld. Nasser, thanks. What's your bench press? It's not a low amount of weight. But I'm not like trying to max out. That's not really my focus. I do like sets. I do sets of 10 normally, but occasionally like sets of 6. But I've gone through like phases where you try to get up like 1 rep. Abdullah. Amen. Do questions repeat on the NBMEs? Yes, I've said that a million times. Offline NBMEs repeat on the new NBMEs. The questions, they repeat all over the place on the real deal. Mo Awad, your CBSE in January was 50%. You had to work since You're studying only a little bit. You're retaking October 20th. Completed QBank once, not yours. Wish it was. Should I focus now? Be Path, Endocrine, and QBank and NBMEs. If your exam's October 20th, I would do half the NBMEs. You got to save some for after the CBSE for your step one. I would blast through Mehlmanmedical like 12 hours a day, to be honest with you. That's what I would do in your situation. That'll get your scores up. You're a candidate for Mehlmanmedical 12 hours a day. I've had anecdotes of people having like 50s on their CBSE and then they get 70s after doing Mehlmanmedical like 12 hours a day in like 6 to 8 weeks. Mohammed Al-Kharkawi. Exams in 3 months. Currently, I'm sticking to your Anki and UWorld. Any recommendations? Yeah, I would do Mehlman QBank if you want a greater score increase. If you don't want a greater score increase, if you don't want that, continue with just your UWorld. You don't have to stop UWorld, but you should do our QBank. And if you don't, you don't have to. Just you won't get the greatest score increase. That's all. Sadia. Gilgamesh. All right, Mahdi, I'm not going to skip you, okay? Mahdi Al-Salawi. Good to see you again, actually. NBME 25, 65%, only 40% QBank done. No eligibility period yet. Do I need to take NBMEs in order because I'm planning to take NBME 30 next week? 3 weeks enough to test. The 65 is borderline, so you need 68 plus. If your exam's in 3 weeks, I just need to see that your NBMEs are 68 plus. I don't care when you sit. Just the NBMEs have to be high enough, and I would make sure you finish 20 through 32 in free 120. Gilgamesh, big fan of yours. I'm 6th year med student, planning to take step. What do you think of? What do you think? That's a ludicrous question. Ludicrous. It's a ludicrous question. Like, when did you first come across my stuff? Like, is this your first point of contact? Have you not heard any of my advice before, Gilgamesh? But if you're doing offline UWorld, I don't like that. I don't like that. I don't like people who like scrape content like that. Okay? Just do it online. NAVP, you have to take a simulated Kaplan exam. How should I study for this to get a 70? Yeah, it's so stupid what Kaplan does with some of these schools. It's because, like, in order to get a good score on Kaplan simulated exam for your school, the way to do that is by doing Kaplan QBank, which is like not what you want to do for USMLE. So in the event that I have a student in that situation where they're like, first I have to take a Kaplan simulated exam, like, whatever, do the fucking Kaplan QBank that they're requiring you to do, get that done. Then when you pass that and your school allows you to go sit the CBSC next, then we'll focus on, like, you do Mehlman QBank. You can still do Mehlman QBank. Like, Kaplan has sort of their like grapple on that with your school. Newer. Cubbies. Don't worry about your QBank score. Cubbies. Where was I? The chat moved on me. Scrolling back up. 62% QBank. Step 1, December 20th. Is this score encouraging? 60s is fine for UWorld. But my focus would be to have you on Mehlman QBank instead, because your scores will go up more. Okay, so if you don't want your scores to go up as much, you can just stay with your UWorld. That's fine. You don't have to switch to our QBank. You don't have to. But I'm saying if you want to get your score up more, you would do Mehlman QBank. Okay, that's your choice. You're in control of that. Shanika, of course you are, but maybe you're not now, right? Shanika, maybe you were when I asked you like 15 minutes ago, maybe you were here, but maybe you're not now, Shanika. Gilgamesh. Have you ever been to Connecticut? I don't know, actually. I don't know. I probably have been in Connecticut, but it's not like a location that ever like that doesn't sit with me, Migs. Because I got family up in New York, and I've driven from New York down to South Carolina. I don't know if I've been to Connecticut though, per se, like stopped in Connecticut. Okay, NBME's 9 to 14. Why are you in Connecticut? Is that why? Migs? NBME's 9 to 14, ranging from 2:30 to late upper 240s. Your exam's in 10 days. Must do in the last 10 days, long NBME 15, free 120. NBME 6 through 8 also, Kaya, you need to do. Simrath Paul, if your step 2 score is coming after, I already talked to you about this. I've said have a 2CK score before you apply, but you're saying if it comes after, then you're just going to have to do whatever you can. I'm not an expert on like the ERAS application stuff, like the dates and all that. I'm not an expert on that. My advice is just get your USMLE score across. Hasitha Gali, you're at 50%, maybe 26. You postpone your exam until October 30th for your step 1 exam. How do I improve my score 70 to 80 range? You've done QBank once over a period of 6 months. So you did UWorld, you said. You did UWorld over 6 months, and you're at 50% NBME 26. And your exam's October 30th. You're not going to be able to sit October 30th. If you're at 50% right now on NBME 26, you're not going to be able to sit October 30th. Okay, you'd be able to sit maybe the earliest end of November. I would say your goal should be to sit USMLE step 1 by the end of this year, truthfully. So what you can do is Mehlman QBank, 40, 80 questions per day, untimed tutor random. And I would do Mehlman Anki in your case, because you need a score augmentation fast. So I would do that. And that 50 should go to the 70s by like December. By November, December, I think you'll be in the 70s. But you got to, it would be Mehlman QBank and our Anki. If you're poor, you can do our PDFs, which are 11 out of 10, but that just depends on how good of a reader you are. Some people don't remember, most people don't remember what they read. So the Anki helps most people. I'm assuming you don't remember what you read if you have a 50 on NBME 26 after already having done UWorld. Let's say, Kieran. There's an NBME question with a carcinoma of the liver where the patient has ascites, varices, and the 2 top choices are Budd-Chiari versus portal vein thrombosis. The answer is Budd-Chiari. Why not? Portal vein thrombosis. Maybe did they give you any other information like hepatic wedge pressure versus portal wedge pressure, anything like that? You could have malignancy with hypercoagulable state, and that leads to Budd-Chiari. And then that's going to back up to the liver, which backs up, of course, and causes ascites. Portal vein thrombosis, I mean, it's possible. It's not impossible. I'd have to see the question, okay? But I can tell you that the mechanism for the thrombosis in the hepatic vein causing Budd-Chiari would be hypercoagulable state and setting a malignancy. Does access to QBank give you access to Biostats videos on your website? No, that's separate. They're not videos, they're audios. We've got our Biostats course is double audios. So I leave you a 3 to 5 minute audio for each Biostats. Basically, our Biostats course is like, you know, the questions on the YouTube, we've got a lot of those for Biostats and ethics, and I leave audios. So there's like a 3 to 5 minute audio for each Biostats question, and then there's a second audio that's under 60 seconds. Okay, you have 2 audios for each question. It's very similar to the first 200 questions on the website. So if you notice my YouTube questions, they don't go back before like 200, 260 or something like that, because the early ones, those are all on the websites with audios. That's why it was originally called the audio QBank before I just changed it to video QBank, because that's what it is. Guys, I'm gonna end this live stream pretty soon. Let me just take like another question. Let me see. Where to find Mehlman QBank? Just go to step1.mehlmanmedical.com, step2.mehlmanmedical.com, step3.mehlmanmedical.com. You know, the people literally DM me this shit. They'll be like, oh, I saw you have a step 1 QBank, but do you have a step 2 QBank? It's like, just go to, there's a menu at the top. If you go to the top, like literally on the top of that page, there's a menu that you can select step 2, step 3. Let me see. Do one more question. Loop Schloop. 67, 72, 64, 68, CBSE in 2 weeks. You need a 67. Well, your scores are not consistent. Like the 3 of your scores are good. 1 of them is not. Okay, so progress through the NBMEs. So you did 20, 21, 22, 23. You can do 24 and 25 right now. You can do those. But pretty much I would just, because you've got 2 weeks, it's like too much time to do just NBMEs, but like not enough time to do like QBank or Anki really. But you can pretty much like cram my PDFs and my Anki for like 2 weeks in addition to doing 24 and 25 NBMEs. Sanya, 66, 69, NBMEs 28, 30. Can you sit? Yeah, you can sit. When can you sit? You can sit after you do the other NBMEs because you need to do 20 through 32. So don't sit until you do all of those, including free 120. All right, guys.